Okay, let's look at general valvular disorders. And let's just talk about the valves a bit too. So the heart has 4 valves in it. There's 2 semilunar and there's 2 leaflet type valves. The left side of the heart has the aortic valve, which is a semilunar valve, and a mitral valve, which is a leaflet type valve. Now, these 2 valves you're going to hear much more of because they get damaged more easily. They're having to live in a high pressure circulation, right? The left ventricle is pumping very high pressures into the aorta to maintain systemic blood pressure. So these valves take a beating over time. Compared to the right side of the heart, which is a low pressure system. And there's a semilunar valve there called the pulmonic valve. And there's a leaflet valve there called the tricuspid valve. So let's go to the left side first. The aortic valve basically has three cusps to it. So and that's why it's called a semilunar valve. And some people can be born with just 2 cusps, and we'll get to that on a later slide. But it's basically 3 cusps that open during systole, and then they close nicely and avoid any or prevent regurgitation of blood back into the left ventricle. It's a very strong valve since it's under high pressure, high blood pressure all the time. Okay, so it has to sustain many years of high pressure going across it. The leaflet valve on that side is the mitral valve, and there's 2 leaflets that are held together almost with like strings that are called chordae tendineae. And those are tendons that attach to muscles in the left ventricle called papillary muscles. So when the left ventricle contracts during systole, what happens? The aortic valve opens and the mitral valves, the 2 leaflets, flap shut. But they want to flap shut and not fly into the left atrium. They just want to flap shut and keep any blood from regurgitating into the left atrium. And that's where the chordae tendineae and the papillary muscles come in. Once the valve closes, those chordae tendineae, those tendons and the papillary muscle within the left ventricle stops the mitral valve from billowing into the left atrium. So it holds it tightly closed during a systolic contraction. Let's go to the right side of the heart. You have the tricuspid and pulmonic. So it's a similar idea, just much lower pressures on this side. So the pulmonic valve also has 3 cusps on it. And the same idea, it opens during systole, closes during diastole to prevent regurgitation into the right ventricle. The tricuspid valve is a 3 leaflet valve. Okay, so there's 3 leaflets. So during systole, what happens as the right ventricle is contracting, those 3 leaflets come together. They close the connection between the right ventricle and the right atrium, and then the chordae tendineae and the papillary muscles hold it very tight so it doesn't billow and leak into the right atrium. So those papillary muscles and the chordae tendineae are very important to make sure that the mitral or the tricuspid valve doesn't become regurgitant. They don't become leaky. Okay, and as you'll see going forward, we're going to lean heavily on the left valves, the left-sided valves, the mitral valve and the aortic valve. Anything that has to work under high pressures, they're likely going to get damaged more often, and that is the case with the aortic and mitral valve. The one to mention on the right side is the tricuspid valve. And just remember, that's the first valve that the blood meets when it's coming back to the heart. So this valve, the tricuspid valve, is at risk for bacterial endocarditis. So you can imagine a dental infection, IV drug abuse, the bacteria gets into the veins. Where do the veins go? They go to the right atrium and then across the tricuspid valve. So 50% of all endocarditis or valvular infections by a bacteria are the tricuspid valve, purely because that is the first valve that the bacteria encounter. So let's just talk about two terms that you should really have a good idea what they mean. Stenosis versus regurgitation of a valve. So stenosis is a narrowing and inability to fully open to allow for forward flow of blood. So if we look at two of the most common valves that are affected by stenosis, it's definitely on the left side of the heart. So aortic stenosis, which is typically caused by old age, and the valve just becomes very stiff and calcified, which is called aortic sclerosis. It just becomes a very stiff valve that won't open fully. Rheumatic heart disease also damages the aortic valve or the mitral valve with scarring, so that can cause stenosis. And some people are born with just two cusps instead of three cusps on the valve. And because of the wear and tear that happens on the left side of the heart because of high pressures, when you only have two cusps on the aortic valve, that can wear it out sooner and you can get aortic stenosis from that. Mitral stenosis, that's the valve between the left atrium and the left ventricle. So if you have a narrowing of the mitral valve, then that means that the blood from the left atrium is going to have difficulty getting into the left ventricle. So it's going to cause the left atrium to be enlarged and distended. And it's also going to cause backup of fluid into the pulmonary vessels because it can't fully flow into the left ventricle. And when you have an enlarged atrium, such as in mitral stenosis, that puts you at risk for an abnormal rhythm, which is called atrial fibrillation, that you're going to hear many times. So what's one of the most common causes of getting atrial fibrillation? A diseased mitral valve. So mitral stenosis also can be caused by rheumatic heart disease because it would also scar this valve. And of course, age can affect any valve. And remember, mitral and aortic valves most commonly affected because they're on the high pressure side. Valvular regurgitation. So this is a leaky valve. This allows blood to go back from where it came from. So if it's aortic regurgitation, it's leaking from the aorta back into the left ventricle. If it's a leaky mitral valve, it's leaking during systole from the left ventricle back into the left atrium. So think of regurgitation as backward flow. Okay, it's regurgitating, almost like vomiting, right? You ate something in one direction, and now it's regurgitating back up. The amount of symptoms will depend on how stenotic or leaky regurgitant a valve is. So if you have severe aortic stenosis or severe mitral stenosis, you will get severe symptoms because there's very little blood that's able to go through the valve. And the same thing would apply for regurgitation. Okay, and this diagram about stenosis and regurgitation is just showing you, again, just in a visual way, what is stenosis? It's a valve that is unable to open fully when it's supposed to. What's regurgitation? It's a valve that doesn't close fully when it's supposed to. So the blood can leak back. Okay, so let's look at some specific valvular diseases. And remember, when we're talking about a valvular disease in the heart, it can either be stenosis, which is a narrowing and a reduction in forward blood flow, or a regurgitation from valvular disease, which means that there's blood leaking back into the chamber that it came from. Okay, so let's start with the mitral valve here. And what are the common diseases that lead to mitral valve disease? Well, years ago, it would have been strep A pharyngitis, leading to rheumatic heart disease. This is much less common now in developed countries. So if you recall, strep A pharyngitis can lead to glomerulonephritis, and it can also lead to rheumatic heart disease. Okay, you can actually also have neurological complications of strep A pharyngitis, but we won't talk about that right now. So mitral valve disease, when we're talking about strep A pharyngitis, is the most common valve involved. Okay, so rheumatic fever can affect all three layers of the heart. So the pericardium, the myocardium, which is the muscle of the heart, and the endocardium, which is the inner lining of the heart. And when we're talking about the mitral valve, that's really part of the inner part of the heart, right? It's part of the endocardium, the lining of the blood of the heart that sees the blood. And what can happen to the mitral valve is it becomes very scarred and inflamed from rheumatic heart disease, and you can be left with stenosis or regurgitation of the mitral valve. Okay, so all the layers can be affected. Typically what's left is mitral valvular disease. And really the way to prevent this is proper treatment of strep A pharyngitis, which is with antibiotics, most typically penicillin, unless of course you have a penicillin allergy. Now, I mentioned this is far less common now because the strains of strep A just do not cause rheumatic heart disease and glomerulonephritis as commonly as they did, say, 50 years ago. Okay, so what can happen with mitral valve disease? Well, if you have mitral stenosis, the blood has a difficult time flowing forward into the left ventricle. So you get a dilated left atrium. You get backup of blood into the lungs, so it can lead to congestive heart failure and pulmonary edema because the blood isn't able to flow forward very well. And because of the atrial dilatation, the enlargement of the atrium, it often can lead to atrial fibrillation. Okay, whenever you stretch an atrium, it can cause irritation of the nerves and it leads to atrial fibrillation. Okay, so the valve is narrowed, there's backup of blood into the lungs leading to pulmonary edema, and also very commonly you get a rhythm called atrial fibrillation with mitral stenosis. What's the treatment for mitral valve stenosis? Well, it's typically surgery, either to repair the valves that are all scarred together, and that would be called valvuloplasty, or a valvular replacement to completely replace the mitral valve. Okay. So as I mentioned on the previous slide, the majority of adult cases are from rheumatic heart disease, often as a child, that led to significant inflammation of all three layers of the heart. But then, because of all the inflammation in the endocardial layer, which is where the valves exist, you're left with mitral valve disease. Now, the mitral valve has two leaflets, and when they were inflamed during rheumatic heart disease, they became very sticky, and they started to form adhesions to each other. And that caused the inability of the valve to open properly. And that results in mitral valve stenosis. Okay? And that's where all of the problems start. The left atrial dilation, and then the backup of blood into the lungs, leading to pulmonary edema and congestion. And of course, if you have backup of fluid in the lungs, the poor right ventricle now is going to have difficulty pumping blood into the lungs because there's high pressures and fluid already in the lungs due to the mitral valve stenosis. Okay, so the other issue is there's less blood getting to the left ventricle, so there's going to be reduced cardiac output. So you can imagine that these patients are going to feel fatigued. They're not getting enough blood flow into their circulation. They may have low blood pressure. They may get dizzy on exertion because they just can't generate the cardiac output they used to. Okay, so let's now look at mitral valve regurgitation. So in the first image on the left, we've already spoken about that, mitral valve stenosis, where there's going to be backup of blood into the left atrium and then backup of blood into the pulmonary vessels, causing pulmonary edema. Okay? Mitral valve regurgitation is where during systole, during contractions of the ventricles, the mitral valve doesn't stop the blood from flowing backwards into the left atrium. So typically during systole, the left ventricle contracts and the blood moves forward into the aorta. Well, in this disease, some of the blood will leak back into the left atrium, and that causes back pressure of blood in the left atrium and can also dilate the left atrium, leading to atrial fibrillation, and also backup of blood into the lungs potentially, right? So now what's the poor left ventricle going to have to do if some of the blood that it wants to pump into the aorta to maintain blood pressure is leaking into the left atrium? Well, it's going to have to work harder. It's going to have to pump more, so it's going to become enlarged. The muscle of the left ventricle is going to become enlarged and thickened because of all the extra pumping it's having to do because of the mitral regurgitation. Okay, So there is also decreased cardiac output in this scenario, because instead of all of the blood moving forward into the aorta, a percentage of the blood is leaking backwards into the left atrium. So what can these patients be left with? Well, they can be left with also an enlarged left atrium. That can lead to atrial fibrillation as their rhythm. If there's a lot of leakage, they can be left with some pulmonary edema because there's so much backflow of blood. They can be left with low blood pressure because there's just not that much forward flow of blood through the aortic valve into the systemic circulation. So they're left with hypotension. And if you're hypotensive, you're going to feel weak, you're going to feel dizzy, because your cardiac output is significantly reduced. Okay, so look at the two different conditions, mitral stenosis versus mitral regurgitation. And remember, many things can harm the valves. And I mentioned on a previous slide that typically it's the left side of the heart valves that are affected because they're under higher pressure. Okay. Okay, so let's just mention this condition called mitral valve prolapse. So this is where the left ventricle during systole is forcefully contracting, trying to get blood into the systemic circulation, so into the aorta. But during the contraction, the mitral valve, which is meant to block the blood from flowing backwards, so regurgitating into the left atrium, the valves are weak and they're bowing into the left atrium. So there isn't necessarily any regurgitation. Sometimes there can be a bit, but it's more that they're prolapsing. They're bowing into the left atrium. And we call this mitral valve prolapse. Okay? So we think it's just due to the tissue that the valves are made from, and in some patients the collagen is just a bit weaker and it's just more stretchable, and that allows for this prolapse to happen. It can cause the symptom of chest pain, but typically there's really nothing to do. So most patients with mitral valve prolapse are asymptomatic, right? And they don't need a mitral valve replacement or any surgical procedure. It doesn't lead to heart failure or heart attacks because there's really nothing terrible happening, right? There's not a significant amount of regurgitation into the left atrium. How do we diagnose this? Well, we usually see it when someone's having an ultrasound of the heart, so an echocardiogram, which shows us the chambers of the heart, and we can see the mitral valve prolapsing into the left atrium. So that's typically how it's diagnosed. And as I mentioned, there's really no treatment needed. Okay, so let's go to the next condition. Again, this is on the left side of the heart, aortic valve stenosis. So a narrowing of the aortic valve, which is going to stop the left ventricle from pumping all of its blood into the aorta. And that's going to put tremendous stress on the left ventricle because it can't get all of its blood out, right? So the aortic valve doesn't fully open properly during systole. So if we're thinking of what kind of a murmur could this give, well, it's a systolic ejection murmur, right? Because you're going to hear the murmur during systole as the blood is trying to rush through this stenotic valve. And really, the amount of symptoms that someone has depends on how narrowed and how stenotic that valve has become. Most of the time, this is really due to old age, where the aortic valve starts to get very stiff and sclerotic and calcified, and it just doesn't want to open as well as it did when the patient was younger. And now, rarely, rheumatic heart disease can also cause aortic valve stenosis from all the inflammation and scarring it created when they had rheumatic heart disease. And lastly, some people are born with a bicuspid aortic valve, not a tricuspid. So the aortic valve usually has 3 cusps to it, but if you're born with a congenital bicuspid valve, well, those poor valves have had to work much harder over the years, and they get stenotic and damaged. Okay? What happens to the left ventricle is it has had to pump through a smaller valve area to get the blood into the aorta. So the poor left ventricle is pumping very, very hard with more force to try and get this blood out of its chamber, and it leads to left ventricular hypertrophy, which just means left ventricular muscle thickening. And it gets thicker and thicker and thicker, and finally the patient can go into congestive heart failure. And why do they go into congestive heart failure? Because the muscle is so thick that there's just no room left in the chamber, and they have what's called diastolic congestive heart failure. Okay? You can imagine that with this poor left ventricle having to pump harder to force this blood through a narrowed valve, there's much more oxygen demands to the left ventricle. So patients can start to develop anginal symptoms where there's just not enough oxygen coming through the coronary arteries to feed the left ventricle, and patients will develop chest pain because the left ventricle is working so hard and not receiving enough oxygen. So aortic valve stenosis will lead to reduced cardiac output, right? The left ventricle just can't get all of its blood out, so they can be left with fatigue, dizziness, syncope, which is loss of consciousness, because they have reduced cardiac output. Finally, the left ventricle has become so thickened and weakened, and the chamber is so narrow now in the left ventricle that they develop heart failure. The blood can't get into the left ventricle. It backs up into the left atrium and into the lungs, leading to pulmonary edema, which comes with shortness of breath and coughing up blood. Okay? So think of really what's happening, this really tight valve making the left ventricle work extremely hard, that's going to lead to angina, heart failure, and backup of fluid into the lungs, causing pulmonary edema. Okay, so this slide's just showing you in the top left-hand corner a normal aortic valve, right? The 3 cusps. And during systole, those 3 cusps move out of the way and the aortic valve fully opens. Okay, let's go to the right side of this slide. A stenotic closed aortic valve. You can even see that it doesn't close very well. So you can actually have a bit of regurgitation back into the left ventricle along with some stenosis. So it's not always that you have either stenosis or regurgitation. Sometimes you can have a bit of both. So let's just assume that we're talking about stenosis here. So there's the closed stenotic valve. And now during systole, look how poorly it opens. A really tight area is a much more narrowed area is open. So the left ventricle has a tremendous difficult time getting out its blood into the aorta because of that stenotic valve, okay? And it really leads to the left ventricle having to work very, very hard for years, leading to left ventricular hypertrophy, left ventricular heart failure, and pulmonary edema. Okay, so all of those things will happen because of that stenotic valve. Okay, so we're almost there. I know this is a long module for sure. I understand it. Luckily, it's over 2 weeks, so it's split in half. So let's go on to aortic valve regurgitation. Okay, so aortic valve regurgitation is where the left ventricle contracts, the aortic valve opens, allows blood to go into the aorta, but then during diastole, where the ventricles are relaxing, the blood leaks back down into the left ventricle. Well, that's going to be a problem, and we'll talk about that in a minute. So what can cause aortic regurgitation? Well, we already mentioned that rheumatic heart disease can harm the mitral and aortic valves in particular. So rheumatic heart disease can cause stenosis or regurgitation of either of those valves, okay? Bicuspid aortic valve, same as in aortic stenosis, can cause aortic regurgitation. Endocarditis is a bacterial infection of any valve. And when you have a bacterial infection on a valve, that valve has now become inflamed. Sometimes the bacteria puts a hole in the valve, and it leads to a very abnormal valve. And since we're talking about aortic valve regurgitation, endocarditis can definitely cause either a stenotic valve or a regurgitant valve, because there's been so much inflammation to try and fight this bacterial infection that landed on the valve. And of course, old age that's led to stiffening of the valve and allowing regurgitation of blood back into the left ventricle. Okay, so this leaking of blood back into the left ventricle makes the left ventricle work much harder, because it just pumped out blood into the aorta, sorry, but now the amount of blood that it just pumped out, some of it's trickling back in to the left ventricle during diastole, and it's going to have to pump it out again. So not only is the left ventricle getting blood normally from the left atrium, but it's now getting leaking of blood back through the aortic valve, and that's a problem. It's going to make that poor left ventricle work hard, and it's going to finally lead to left heart failure, because the left ventricle finally will say, after years, I am exhausted, I'm weak, okay? And when the left heart ventricle fails, you get backup of blood into the left atrium and then into the lungs, called pulmonary edema or pulmonary congestion, whichever one, okay? And of course, when you have pulmonary congestion, that's going to cause backup of fluid and strain to the right side of the heart, and will lead to right heart failure. When you have right heart failure, you get backup of fluid into the veins, and you get venous congestion, which will be edema in your legs, elevated JVP, distended neck veins, hepatomegaly, because it's filled with blood, so the liver will be filled with blood, okay? So when we're talking about aortic valve regurgitation, again, think of all the stress it's putting on that poor left ventricle that's finally going to fail because it's having to pump so much more blood that's leaking back into the left ventricle, and also the blood it's receiving from the atrium. Okay, so let's just look at the sequence here. We've already done this on the previous slide, but there's retrograde blood flow, meaning there's blood flow leaking back from the aorta into the left ventricle. Okay, that's regurgitation. That results in more fluid in the left ventricle. So the left ventricle is having to pump more and more to try and get the blood into the aorta. So it's volume overloaded. That's going to cause backup of blood into the left atrium, because the left ventricle has been trying to compensate so much by getting thicker and dilating because of all this regurgitant blood. Okay, so finally, over years, the left ventricle says, I just can't do this anymore. I can't contract like this. So it's weakening. And as it weakens, you get backup of blood into the lungs. And when you have backup of blood into the lungs, into the blood vessels of the lungs, I should say, well, that's going to reflect as hypertension in the venous system in the lungs. And when the right ventricle starts to tries to contract, it's going to be met with high pressures in the pulmonary artery, because that's where the blood is backing up to. So that's going to lead to right ventricular failure. When you get right ventricular failure, you get all the backup into the venous system that we just spoke about. Okay, so what are the symptoms of aortic valve regurgitation? Well, what are the symptoms of lack of blood supply to the aorta? Well, that's going to be weakness, fatigue. I'm dizzy because my blood pressure is low, because the blood's leaking back into the left ventricle. What are the backward symptoms going to be? I'm going to be short of breath. I might cough up some blood because I have pulmonary edema. I might have leg swelling finally as the right side of the heart starts to fail, because the left side of the heart is failing. Okay, so let's just connect the valve disorder with the murmur. Okay, so aortic stenosis. So when are we going to hear a murmur with aortic stenosis? Well, during systole is when the blood is going to try and get out of the left ventricle and flow into the aorta. And because there's a narrowing there now, there's a stenotic aortic valve, you're going to have the murmur during systole, okay, during the systolic contraction. Aortic regurgitation is going to happen during it's going to be a diastolic murmur. Right, so the left ventricle pumps, it moves blood from the left ventricle into the aorta, it then relaxes, and during diastole, where the aortic valve is supposed to completely close and it doesn't, blood drips back into the left ventricle and we hear it as a diastolic murmur. Okay, mitral stenosis. Well, what kind of murmur is that going to be? Well, it's going to be when blood is trying to get through the valve, right? And that is during diastole. So the left ventricle is relaxing. The left atrium is supposed to be delivering blood into the left ventricle, but it can't because there's mitral stenosis. So there's going to be turbulent blood flow resulting in a diastolic murmur. Mitral regurgitation is typically a systolic murmur. During contraction of the left ventricle, some of the blood is getting into the aorta, but some of the blood is leaking back into the left atrium. And it's going to cause turbulent blood flow through the mitral valve, so you get a systolic regurgitant murmur. Okay. So just remember that the mitral and aortic valves have far more problems because they're having to deal with the high pressures of the heart compared to the right side of the heart, which has the tricuspid and the pulmonary valves. Okay? Now, when we're talking about the tricuspid and pulmonary valves, the murmurs will work the same way, right? So just think of, when is there blood flow that's trying to get through a stenotic or a leaky valve, and that will tell you when the murmurs are occurring, right? So tricuspid regurgitation is going to cause a systolic murmur, right? Pulmonary stenosis is going to cause a systolic murmur. Tricuspid stenosis is going to cause a diastolic murmur, and pulmonary regurgitation is going to cause a diastolic murmur. I hope I got that right because I know it's been a long time in this module, so if I didn't get that right, I apologize. Anyways, I know this is a long module. I don't think there's going to be one at all as long as this module has been. Luckily, it's broken up into 2 weeks. Okay. See you at next module.